is Andrea Green, PN student, and today I'm going to be demonstrating changing a wound dressing, which includes irrigating it, doing a culture swab for it, assessing it, measuring it, and then doing a wet to damp dressing change. So I'm going to start with my hand hygiene, as I am in my supply room and I've gotten all my supplies already, and I'm just checking my healthcare provider's orders, and I see I have patient Shirley Coast, date of birth 5/15/64, and it needs a daily dressing of wound with a wet to dry dressing for PRN, and it's 0900 right now, and I need to obtain a specimen for wound culture as well. So now I will make my way into my patient's room. I will knock and provide privacy. Hi Shirley, how are you today? You're okay? Are you in any pain? A little bit? That sore is bothering you? Yeah? Okay, so I'm just gonna get you to confirm your name and date of birth for me, Shirley. So we have Shirley Coast, 54, Shirley Coast, 54, date of birth 5/14/64, 5/14/64, and I see you have an allergy to codeine, but we don't have to worry about that today. So Shirley, we're gonna do a change of your dressing, so I'm gonna have to flip you onto your stomach, if you can help with that. So Shirley's helpful and she'd help me, and if not, I would get another nurse to assist me in turning Shirley. So I'm just gonna try and put the mannequin onto the stomach as best as I can. And then I would turn the head to a side so then they were able to breathe. So then after that, I am going to do hand hygiene again, as I have touched the patient. I'm just going to open my dressing change tray so then I can get my biohazard bag. And also I would cover the patient just to what I need exposed. So I'm just going to get my biohazard bag out and ready. So now that that's ready, I can grab a pair of gloves. And I see that the dressing is soiled, so I will change it, and I need to collect a specimen while I'm changing it as well. So I did my hand hygiene and I have a pair of gloves on, and now I can take off the old dressing, and if the tape was really sticky and I couldn't get it off easily, I could use an adhesive remover, and I'd be careful in removing the tape, especially for elderly clients, as it can cause skin tears. And then I would fold the dressing in itself and put it in my biohazard bag to go with that. So now I'm just going to assess the wound, and I press around it, assess the skin color, the temperature, the wound itself, the wound bed, any pus when I press. So now that that's done, I would change my gloves and I would do hand hygiene. And then I'm going to measure the wound without touching the actual wound bed itself. So 75 millimeters by 65 millimeters. So I would, when I go back to document, I would document that it was 75 millimeters by 65 millimeters for my measurements. So now I'm going to irrigate, and I would change my gloves again. And I am just going to prepare my needle, so I have new gloves on. And I'm just going to put this needle tip, or this catheter tip on, and I can put it into my tray as it is clean. And I would remove this. And I can put it underneath the patient to protect the bed. So then I'm going to need one gauze to dry. And I'm just going to take out this dressing, and I can set it off to the side as long as the inside does not touch the table. So then I'm going to take my syringe, and I'm going to draw up 30 milliliters. of sodium chloride. And then I'm going to go to my patient and I'll have my kidney basin here. I'm going to irrigate from top to bottom, going side to side. And I would irrigate until the fluid comes out clear. So now I see that my fluid is clear, so I can finish irrigating, and I would put this directly into the sharps container, but because other people have to use it, I'm just going to put it in here for now. And then I am going to pat to dry the outside skin to make sure it's not wet. And then I would dispose of that. And then I can dispose of my kidney basin, Mercilli policy. And now I would change my gloves again, as I'm going to do a culture swab. So I have now irrigated the wound so it's clean. And I have done hand hygiene and I've changed my gloves. So I'm just going to take the cap off of here. And then if I can get my camera person to zoom in, and it'll show me doing a circular motion on the red area and not the area with all the slough and the dead skin cells. So now that I have gotten that, I would put it into this tube, making sure not to touch the swab to the sides of the tube. Whoops. And then I will grab my pen, and I will grab a label, and I will date it, initial it, and time it is 0900. And then I can take this off and put it onto my swab, and then put this into my biohazard bag, and I would delegate my CNA to run it to lab for me while I finish up. And I forgot to mention that when I measured earlier, if it was tunneling, I would have used one of these and to measure the depth of the tunneling, but this client's wound is not tunneling. So then I would change my gloves again, and I would just dispose of this and get this out of my way. So I have done hand hygiene, I've changed my gloves, and now I can go to put a new dressing onto the client. So I'll pour my sodium chloride into my, my change tray, and then I will just grab my tape before I continue while that soaks. Okay, so again, I've done hand hygiene, I have clean gloves on, and now I'm going to wring out the gauze to make sure it's not soaking, and I'm just going to fluff it. And then I'm going to pack it into the wound, making sure it's not touching the outside border of the wound bed. And then this one again, if it's extra damp, I would wring it out and place it over top of that gauze, and then I can take my pad and put it over top of that. And then I'll take my tape, and I'm just going to tape, and I want about 1/2 inch to 1 inch on the ends and on the sides, so then there's extra. So I will make sure that this is taped down well so it doesn't move easily on the client or it doesn't fall off. And then I'm going to initial it, date it, and time it, which is 0900. So then I'm going to clean this up and put it into my biohazard bag as well. And I would change my gloves, or if they were contaminated. Now I can flip Shirley back onto her back. So Shirley, we're just going to go back onto your back. So if I needed assistance turning Shirley back onto her back, I would get it. Or else if she was a big help, then that would be okay as well. And then I would make sure my patient is comfy and that she tolerated the procedure well. She's not in any pain or discomfort, as we would want to manage that. I would leave with the bed rail up, leave her with the call light. I would do hand hygiene, remove my gloves, and then I'd go back to the nurse's station and document the characteristics of the wound, the measurements I took of the wound, that I sent the culture swab to lab, as well as the dressing change and how the client tolerated the procedure today. And that will conclude the video.